My name is Sandy Loinger. I'm the district nurse for District 89. I wanted to make sure that we spent some time to review the health guidelines so that when students return to school, we know how to keep them healthy and safe, and for you to be familiar with the reasons why you should not send your child to school. The self-certification form is really just a reminder to us to be looking at our kids every day to make sure that they're healthy and that they don't have any of the symptoms that would exclude them from coming to school based on the Illinois Department of Public Health guidelines at the time. We've outlined those symptoms to look for on the self-certification forms, and we'll need the parents to complete those forms for each of their children and send those forms with the child to school every day. So parents, you should make sure that you keep your child home from school if they have any of these symptoms. A fever, and the fever is identified as 100.4 or higher. New onset of moderate to severe headaches, shortness of breath, a new cough, sore throat, vomiting or nausea, diarrhea, abdominal pain from an unknown cause, new congestion or a runny nose, new loss of sense of taste or smell, fatigue from an unknown cause, muscle aches or body aches. The new guidance from the Illinois Department of Health made sure that we are looking at new onset of symptoms that are not attributed to allergies or any other pre-existing condition. Children that come to school without these symptoms but then would develop any of these symptoms during the school day would be sent to the nurse's office for evaluation. We have set up 2 different nursing stations in every school for this school year. We have the regular nurse's office where we would be seeing children with minor issues, maybe medication administration, but then we also have a room that will be specifically set aside for any students that have COVID symptoms. We will keep them separated from all other children and do that assessment to determine if they do need to go home from school. And all of the symptoms that I read previously would be symptoms we would be looking for to see if they met those criteria and would need to be excluded or go home for the day. So if your child is home with one of the symptoms, how do they then come back to school? The things that we would need as a school would be a document from your physician saying that your child either is negative for COVID-19 or they have a different diagnosis. So maybe they have symptoms but have an alternative diagnosis than COVID-19, like say allergies, migraines, something of that nature. So there's a reason they have these symptoms, but it's a different diagnosis than COVID-19. So that letter from your physician would be helpful. If your child has symptoms and they're unable to go to the doctor to receive documentation, or they don't have documentation of a negative COVID test, then the child would need to stay home from school for 10 calendar days before they could return to school. Their symptoms would have to improve during that time. They would need to be fever-free, but they would need to complete 10 calendar days away from school before returning to school. I know that all of these health guidelines are very challenging for families and can be very disruptive to your home environment. I greatly appreciate you being so conscientious to follow them for the safety and health of your own children, the children at our school, and certainly the staff in District 89. We will all get through this together by following this guidance, and please reach out to the healthcare providers in the buildings or myself if you have any further questions.